local storyteller, WVON.
Good morning, good afternoon, rather. My name is Dr. Ross McMillan. I am subbing in for Dr. Edwin McDonald today. Welcome to another edition of Uchicago Medicine's Community Health Focus Hour here on WVON 1690 AM, the talk of Chicago. Today we have a life-saving conversation, Screenings Save Lives, the truth about colorectal cancer. Colorectal cancer is one of the most preventable cancers if caught early. Today, we'll talk about the facts, break the stigma, and share resources so you and your loved ones can take action. I'm joined by three outstanding guests today. Dr. Leah Goldberg, resident physician in the Department of Internal Medicine, and also a future oncologist. Commissioner Bill Lowry, Cook County Commissioner, 3rd District, as well as Ms. Candace Henley, Chief Surviving Officer of the Blue Hat Foundation. Before we dive in, I'd love to have our guests introduce themselves to our listeners. So, Dr. Goldberg.
Hi, everyone. My name is Leah Goldberg. I am an internal medicine resident physician at the University of Chicago. And coming this summer, I will be starting training as a hematologist and oncologist. Happy to be here today.
Awesome. Thank you for coming. Commissioner Lowry.
Thank you, Dr. McMillan. It's wonderful to be here with all of you and to be here with our WVON family. I am Bill Lowry. I serve as Cook County Commissioner of the 3rd District. Yes, I'm on the ballot Tuesday, but I'm unopposed, so I think I'll get a 3rd term.
Good luck.
And well, thank you. I appreciate that. I serve as chair of the Health and Hospitals Board for the Cook County Board of Commissioners, and I serve as vice chair of the Cook County Health Board of Directors. So for me, during my almost 8 years of service, I focused each and every day on economic equity, community equity, environmental equity, and then healthcare equity, both traditional and behavioral. But I can say that healthcare has really become my why. And it's become my why for two reasons. One, healthcare is a right shared by us all, not a privilege reserved for the few. But it's also become my why because I'm a 2-time cancer survivor since 2018. So this is a very, very important conversation. And Dr. McMillan, you're so right. Knowledge is power. So if we're taking the right steps, if we have a cancer diagnosis, we'll know it early, and then you've got a great chance of surviving, as I have.
Fantastic. Thank you. And congratulations on your cancer survivorship.
Thank you.
Of course. And Ms. Henley?
Hi, I'm Candace Henley. I am a 23-year survivor of colon cancer, and all-around advocate of everything colon cancer, cancer-related by proxy. I was, as a good friend called, a very pissed off patient because every disparity that you can think of is something that I experienced, and realizing that when I was diagnosed, our community didn't know what colon cancer was. I didn't know what it was at 35, and I didn't know that I had a family history. And so it led me down this path of not only wanting to raise awareness, but also wanting to make change, because everything I kept hearing and reading said somebody died from colon cancer. So I want to be the change maker.
Thank you. And also congratulations to you on your survivorship.
Thank you.
So I'm going to tap into you all's expertise as well as you all's experiences. But before that, I just wanted to talk to our listeners rather, and ask our Facebook friends to share today's show and invite others to join us. And if you have any questions or comments, call us at 773-591-1690. And keep those calls brief if you could, about 30 to 45 seconds. So I did say I'm Dr. Ross McMillan. I'm also a gastroenterologist at the University of Chicago as well. Just wanted to let you all know who I am as well. So let's start with some of the basics. What is colon cancer and why is it so important in our community to talk about it? So Dr. Goldberg, can you give us a little bit of more information about what colon cancer is?
Absolutely. So colorectal cancer refers to cancerous growths in the colon and rectum. There are a number of risk factors that are important to be aware of so that you can minimize your risk of developing colon cancer. So the risk factors I think of first are lifestyle. So a diet that's very high in red meat, processed meats, a diet that's low in fruits and veggies, low in vitamin D. Those are all high risk diet qualities that can increase your risk of colon cancer. Additionally, smoking increases the risk of many cancers. Colon cancer is no exception, similarly with alcohol. And a lack of physical activity can actually increase your risk of colon cancer. Beyond that, there are other points that other guests have kind of alluded to already, but having a history in your family of colon cancer can increase your individual risk. And also having certain conditions, so ILD or inflammatory bowel disease, certain hereditary syndromes can all make it more likely that you develop colon cancer. So really important that people understand how to set themselves up for success. And if they are at increased risk, that they know what those risks are.
Okay. And one other question for you. What are some of the symptoms that people should be looking out for that might kind of portend colon cancer, or at least screening for colorectal cancer?
Absolutely. So that there are really a few that people should be aware of. First and foremost is anytime that there is blood in your stool that's abnormal. And so that is something that you want to talk to your physician about straight away. Even if you have had a history of hemorrhoids or you think you may have a hemorrhoid, blood in the stool should always be evaluated by a physician. The others are abdominal pain, so unexplained, ongoing abdominal pain, weight loss, especially weight loss that is unintentional. And then finally, anemia. So having a low hemoglobin, even if you may not know that you have a low hemoglobin, there are symptoms of anemia that people can be aware of. So if you're feeling very fatigued, if you're feeling dizzy, those can all be signs, shortness of breath, of a low hemoglobin and anemia. And it's important that if you do have anemia, that you see a physician to evaluate whether or not that may be indicative of something more malignant.
Thank you. And I just wanted to reiterate one of the things that you said. Blood in your stool is not normal and should be evaluated, because I think that that is very important for people to understand.
Definitely.
And Ms. Henley, I know that you've had an experience similar to this, and
Yes.
you've had some really frightening symptoms. And so I just wanted to just take a step back and ask if you can tell us about your journey and your story and what brought you to this point where you have the Blue Hat Foundation.
Absolutely. Everything that was just mentioned, I had the anemia. I didn't have the blood in the stool that I could physically see, but I had the tiredness and just not having the energy and the weight loss, but attributed to, the fact that I was a bus driver, mom of 5 kids. So you could, make the case for it. And then one day I realized I hadn't had a bowel movement in 2 weeks, and my stomach was so hard. I was having gas. Nothing worked. And so I went to the emergency room. They gave me something, sent me home. No questions asked. No, it's just, again, assuming that my lifestyle as a bus driver, because and so by the third time I made it to the emergency room, the second time led me to get a hysterectomy, because they assumed that because I was anemic, that it had to do with my history of fibroid tumors and endometriosis. So they sent me back to my my gynecologist, and he says, well, you know what, we've been meaning to do that anyway, so let's get it done. Did all of that, and that was supposed to fix me because I had a blood transfusion. Went back and everything was fine for a couple of months. But then I started taking again. The third time I went to the emergency room, my primary care doctor said, have them call me. And he had them do a FOBT test in the emergency room, where it found blood in my stool. I had emergency colonoscopy, colon cancer surgery, never left a hospital in 10 days. And that was the change, because I didn't know what colon cancer was. I was 35 years old. I'm a mom of 5 children. Now what? I didn't know that at the time that I had a family history of colon cancer. I learned that 11 years later that my dad and 2 of his sisters had colon cancer. So I went through this journey not knowing what it was, and everything that I read in the literature didn't look like me. They were all older white people, older Black people, and they all said somebody died from colon cancer. So that left me mortified. And it also left me in a state of depression, because if nobody looks like me, and if you're telling me my life expectancy is 3 to 5 years, then why am I still here? Why wait? And so the emotional toll, along with the physical toll, because I became homeless as well, because I couldn't work. I was a bus driver for the city of Chicago. I didn't have disability pay that paid the bills enough. And I didn't qualify at the time in 2003 for Social Security, because at the time Social Security was not, I mean, disability was not, colon cancer was not on the list of disability for Social Security. I didn't have navigation to say, appeal this. The city of Chicago didn't have services for homeowners. So I didn't have any. So everywhere I turned where services were supposed to be available, they weren't available for me. And so that's what led me down this path of, I need to talk about it. And I was so angry when I would go and talk to somebody like, hey, well, why am I, why aren't you doing this? Well, we just, and that was the answer. Well, we just what? And so it got to the point where I was like, I was so pissed. And it led me, how do we do something? How is it that African Americans have the highest rates of diagnosis and death of colon cancer, yet no one is in our community talking about it? And so that's what led me here.
Thank you for sharing your journey.
Thank you.
I just wanted to mention one thing. So you said FOBT.
Yes.
So that is a fecal occult blood test.
Yes.
Dr. Goldberg, and I'm going to get to you, Commissioner. But I just had this one other question for Dr. Goldberg. Can you lead us through some of the various screening tests that we have for colon cancer and talk to us about the difference between occult and overt blood in your stool?
Yes, absolutely. So, Candace, you mentioned that you could not see blood in your stool, but there was, in fact, blood in your stool. And so the occult test looks for blood that is not visible to the naked eye, but is still present, whereas overt bleeding is bleeding that we can clearly see with our eyes without any additional assistance. So the fecal occult blood test, looking for blood that we can't see, is really helpful when we have unexplained anemia and, trying to understand whether there's something that we may not be able to see ourselves. That being said, there are many other types of screening for colon cancer, and the screening that is best for you is a decision to be made in conjunction with your doctor, but it's also unique to every patient. And what one patient prefers may not be what the next patient prefers for their health. So traditionally, colonoscopy, has been kind of the gold standard because GI physicians such as yourself, Dr. McMillan, and Dr. McDonald, are able to see with a camera inside the colon and look for anything that could be abnormal. And so that is what the colonoscopy achieves. It allows for direct tissue biopsy if there's an area that looks suspicious, and that can give us concrete pathological evidence. However, for various reasons, colonoscopy may not be what someone prefers. And luckily, there are other tests, such as the fecal occult blood test or the FIT, which is the fecal immunohistochemical test. And those tests can detect different markers that can give us some indication as to whether there is cancer in the stool or whether there's findings to suggest there may be cancer in the colon. In addition to that, there is blood-based testing, which is not as commonly, ordered in primary care. And then there is image-based testing. So a CT colonography is another option for some patients. And what a CT colonography does is you go in a machine, kind of looks like a donut, and you go into that machine, and it basically takes many, many, many x-rays, and it gives us a more 3D visualization of the colon to allow us to know if there are areas of concern or suspicion. So that's kind of the overview, the 4 different types. I don't know if you have anything to add to that.
I was just going to add that colonoscopies are the only tests that allow us to prevent colon cancer. So some of these other tests, the stool-based tests, the imaging-based tests, which is a CAT scan, as well as the blood-based tests, they can detect any abnormalities, but they cannot treat prior to doing so. So the only screening test that we have that is able to prevent colon cancer is a colonoscopy, where we can remove polyps, which are abnormal growths of tissue that can turn into colon cancer. Eventually, we can remove those and thus prevent colon cancer. So just wanted to point that out. Now, Commissioner Lowry, I know that cancer prevention and cancer awareness is something that's very important to Cook County, and particularly in the city of Chicago. But can you alert us to some of those resources that our listeners might have available to them?
Sure. First of all, we're focusing on colorectal cancer, and we should, because the data tells us that cases are rising sharply in adults under 55 at a rate of 3% annually. So this is really, really vital. But we're seeing that with other types of cancers as well. And the one thing that I think is very important for us to embrace, and I say this whenever I'm in the community, we have to get our regular evaluations, annually. And I always say, do it your birthday month. You don't forget your birthday month. Half of us take off from work for our birthday. Let's go ahead and get that physical, because that's vital. Whatever cancer you ultimately may be diagnosed with, early detection is the key. And that's the only reason I'm here today, because I've had prostate cancer and I've had renal cancer. But it's because of early detection, because the one thing I was good at was getting my annual physical. So that's something that's very important. And I want to make sure that everyone within the sound of our voices, that's a takeaway. The other thing that I just want to touch on, Candace, you hit it, but we've got to look at really creating healthcare as being a vital part of just our life, right? As we sit here today, there's a 30-year life expectancy difference between those of us who live in Inglewood versus those who live in Edgewater. Now, part of that is access to healthcare. That's what I and others, we must do better. And we must make sure that we do bring healthcare facilities, both traditional and behavioral, to our community. But then once these opportunities are presented, we've got to avail ourselves to them. And, when I talk about how we can lessen that disparity relative to life expectancy, it's not just access to healthcare, it's access to preventative healthcare. So to your point, doctor, one thing that what I've done myself in my current role, my second cancer was diagnosed in May of 2023. I went to see my primary care physician. Again, I'm good at that. He says, "How you feeling?" I said, "I feel great." He says, "You look pretty good." He said, "Let's take a half day and just get scans to make sure we know what's going on in your body." So I did that. And even though I had good insurance, I didn't have a diagnosis. So I had to pay thousands of dollars, right? And one of those scans showed that I had a mass on my right kidney. And that led to further consideration and ultimately that diagnosis. So in September of 2023, I had my right kidney and that mass removed. Thankfully, it had not spread. It was early detection. But I said to my wife, I got to come up with a way to help others get this information, and others maybe when they can't pay thousands of dollars to get this information. And then it was 3:10 a.m. a couple of weeks later, I pop up in bed. She goes, "Bill, you all right?" I said, "I'm all right." But it came to me. And what came to me was what I then created, which is the Cook County Health birthday screening program. And under our program now, women throughout Cook County who are at least 40 years of age can get a mammogram at Stroger Hospital or any other participating Cook County clinic. And if they don't have insurance, it's free. And now men 45 and older in Cook County can get a prostate screening. If they don't have insurance, it's free. So now the program has been up and running for a year, and we've started to get some data, which I think is very important. The data is as follows. For uninsured women in Cook County, mammograms are up 54%. For mammograms overall, so including individuals who have insurance or don't, it's up 17%. And prostate screenings are up 13%. So this program is having the desired effect. It is fostering early detection, overall wellness, because Candace, to your earlier point, it's accompanied with the physical. So there are individuals who thankfully may not have cancer, but they find out for the first time they have diabetes, high blood pressure, et cetera. So it's helping overall wellness. But most importantly, this program is saving lives. And I'm now looking at expanding the screenings to include lung. And after this consideration, we're going to talk about colorectal as well. But these are ways that we can make available to all of us the tools that we each need to know what's going on in our body, because knowledge is power. And if you're going to have a cancer diagnosis, early is important. Last thing I'll say before you move on, my maternal grandfather, he died from colorectal cancer. And for years, he thought he just thought he had hemorrhoids. And that's the other piece that I think we're illuminating. If you have blood in your stool, if you're in the habit of having an annual physical, you'll share that with your physician. You'll get a colonoscopy. These are necessary steps in overall wellness.
I hear that we have a caller.
Hello?
Hi.
Hi, my name is Helen. I just have a question, a quick question.
Of course.
Are those free mammograms? Are those tests that's free? Are they income based or not? Most things that's free are all income based.
They're insurance based. So if you have insurance coverage, Cook County Health will bill your insurance company. If you have any type of copay and there's any issue or question about your ability to pay that, Cook County Health will work with you. If you don't have insurance, it's absolutely free, whether you're talking the mammogram or the prostate screening. And this has never been more important because we look at the patients in the Cook County Health System. Uninsured patients have risen from 13% to 24% in just 4 months. So this is very important. The other thing I'll add about the provision of healthcare at Cook County, we have charity care. So we don't turn anyone away. If you come and you present and you have any healthcare challenge, we're going to do everything in our power to manage that and to help.
You know what? You really haven't answered my question. My question is, okay, even if you have a job and you work and you don't have insurance, are there questions about your income and everything in order to get a free mammogram? That's my question.
Thank you. No,
Because most things that's free, it's all income based.
it is not income based. So if you have a job but no insurance, you will be entitled to have a free mammogram.
Okay, thank you. Thank you very much.
Okay. Before I go on, I just wanted to relay the following. And this is outside of just cancer and cancer prevention. But we also know that mental health is extremely important to all of us. And so
Yes.
if you're experiencing a mental health crisis, please call or text 988 suicide and for the Suicide and Crisis Lifeline. Okay. This can help with screening and help with anybody who is in crisis at that point. So I just wanted to make that following point for some of our listeners. And with that said, I just wanted to go back to some of what we had spoken about. Commissioner Lowry, you mentioned that there are these resources that are available, or at least are becoming available. It is up to every individual, though, even if the resources are available, to avail themselves or take advantage
Yes.
of those resources. So I wanted to open it up to all of our panelists. Even if the resources are available, what are some of the barriers that you all have either personally experienced or seen in others that may not allow people to take advantage of those resources, or that people may see as they may be a little bit fearful or apprehensive about taking advantage of some of those resources?
Can I?
Absolutely.
So, in my case, and what I continue to hear is knowledge. We don't know that these resources exist. And so, if the resources are siloed, then how do we have access to that? If they're not on the city website, if they're not, and a lot of times they're at different institutions. And if I don't attend that institution, I don't know that it exists. There are resources that even if they are listed, they're no longer viable because no one is keeping the list up. And there's fear of being judged, fear of hearing the word no, right? Because especially when you're at the end of your rope and when you're going from corner to corner to pillar to post and you still aren't getting, it's like, I can't take not one more no.
Mhm.
And so within that process, though, I'm glad that you brought up and shared the information about the mental health line, because that's where I was. I had heard no, we don't have it, it's not available, to the point where that was the only thing that I had left. And so I knew I had insurance if I died. So access to the information is the problem. Today is the first time I'm even hearing about your information.
Mhm.
So how can we amplify that, right? For someone after this call today, how can we share this, valuable resource and the information that you're doing? So,
Thank you. Before I have you all answer, we do have a caller. So, caller, can you please state your name and your question?
Hi, good afternoon. My name is Lester. My question is, at my age, it's suggested that I have a colonoscopy every 5 years. With this rectal cancer, is there anything that can happen in between? And is there anything I should be on the lookout for? I am a prostate cancer survivor. Continue to do the checkups on that. Is there anything that my physicians can do to say, hey, is there any other tests available as a routine?
Absolutely. I'll let Dr. Goldberg talk about this, and I can chime in as well.
Yeah, absolutely. So I will say that Dr. McMillan, you'll probably give some more information on why the guidelines are for 3 versus 5 versus 10 years. But based on what gastroenterologists see on the colonoscopy, that allows them to give us in primary care the best recommendation for how often a patient should come back. And so again, these conversations are really individual based and tailored to exactly what is found on your screening colonoscopy or your diagnostic colonoscopy. And so 5 years is a common recommendation based on certain findings that they may see on a colonoscopy. But in the meantime, it's very important in that interval to continue with your annual physician check-in so that you are getting at least an annual complete blood count, which will look at your hemoglobin. They may also send out iron panels to look for iron deficiency anemia or low hemoglobin that is caused by having low iron. And then certainly continuing to do self-monitoring, making sure that you're not having any changes in the quality of your stool. For example, your stool is not becoming thin and pencil-like or changing in its caliber or color, that you're not having new or worsening blood in the stool, that your stool is not dark and sticky, which can also be a sign of blood, that you're not unexpectedly losing weight. All of those things that we talked about as kind of warning signs of possible colon cancer, it's still very important to keep an eye out for those, even if you have had a colonoscopy, to make sure that before your next colonoscopy is due, there's nothing changing that we can get on top of earlier.
I have a question, if I could ask, just to follow up.
Absolutely.
So I'm seeing now advertised with some regularity these kind of at-home tests. You maybe can get something at Walgreens or CVS. Are those reliable tests when you're trying to determine if you have colorectal cancer?
I would not rely on those tests. I would make sure that any test that you're getting has been screened by your physician. It can be your primary care physician or your gastroenterologist, but just making sure you have an FDA approved test, or that you are getting your preventative tests, i.e. your colonoscopy, rather than something at home, because those have not been shown and proven through rigorous testing to be able to screen at a rate that is acceptable. Okay.
Great.
And then one other point about your question, Lester. So most people should be screened every 10 years for colorectal cancer, starting at the age of 45. There are certain things that can be seen on your colonoscopy that may change that time frame based on the next colonoscopy. However, the interval for some of the other screening tests, including the Cologuard, which is one of those stool-based or FIT tests, is 3 years. So the interval of time can change depending on whichever test that you're getting, but the colonoscopy should start at 45 and be every 10 years if you are at average risk. If something is seen, like a polyp, then that can change the timing of your test. Or if you have a family history or a personal history of a genetic issue, then that can change the timing of your testing or the point at which you are starting to get your testing. I do want to continue this part, especially about some of the barriers in our discussion, but we're going to take a quick break so that we can hear from some of our sponsors, and then we'll come back.
Awesome.
Thank you.
Thank you.
On election night, WVON will be your elections headquarters, keeping you connected to the voices and the issues that matter most to our community. WVON's Rufus Williams, Cleopatra Draper, and David Seaton will make up our roundtable, and we'll have a team on the street at every race that matters. From U.S. Senate to Cook County President to the 2nd and 7th Congressional District races, we'll take you there. When it comes to the March 17th primary election, WVON has got you covered, bringing you the information you need from the station you trust. Get out and vote, then turn us on Tuesday for election night coverage, because at WVON, politics is what we do.
Who is everyone supporting to be our next state rep? Democrat Asia Kearney, a lifelong South Side resident. Asia's ready to work with Governor Pritzker and fight back against Donald Trump. She's a union member, so you know she's backed by Illinois SEIU. They'll work together to bring down costs and create good-paying jobs. And Asia's a tireless advocate for good public schools. That's why Chicago Teachers Union, Illinois Federation of Teachers, and Cook County College Teachers Union are supporting her campaign. Community leaders like Commissioner Carrie Steele and Alderman William Hall support her because she's committed to keeping us safe. If you're ready to elect a leader who will work hard to bring down costs, strengthen our public schools, protect your rights, and focus on public safety, you need to be with Asia Kearney too. Cast your ballot for Asia Kearney by March 17th. American Future paid for and is responsible for the content of this advertising. AmericanFuture.org. Not authorized by Asia Kearney or any federal candidate or committee.
Medicine needs your help. Join their Welcome and Wayfinding volunteer program and make a real difference. They're looking for friendly, compassionate people to guide patients and visitors, offer directions, and provide a warm, supportive presence. Just a few hours a week can reduce stress and make someone's hospital visit easier. Learn more and sign up at uchicagomedicine.org/volunteer. That's uchicagomedicine.org/volunteer. Chicago Medicine at the forefront.
This year makes your health and your family's health a priority by visiting Chicago Department of Public Health clinics at no cost. CDPH immunization clinics provide vaccines for children 0 through 18 years of age whose parents or guardians are unable to pay. This includes vaccines for flu, COVID-19, mpox, and measles, mumps, and rubella. Our mental health centers offer care that provides support for emotional, traumatic, or behavioral difficulties. All mental health centers provide services for adults, children, and adolescents, including intake or screening, individual therapy, group therapy, case management, and medication management. And if you prefer to stay home, we also offer virtual therapy. You can also take care of your sexual health with confidential testing and treatment for sexual transmitted infections at our specialized clinics. Finally, our WIC clinics provide nutrition support, breastfeeding assistance, and guidance on feeding your children. Best of all, these services are completely free, no matter your immigration status or whether you have health insurance. Visit chicago.gov/health services to find your nearest clinic to meet your needs. Your health and your family's health deserve care.
All right, welcome back. This is the University of Chicago Medicine's Community Health Focus Hour right here on WVON 1690, the Talk of Chicago. I'm your host, Dr. Ross McMillan, a gastroenterologist at the University of Chicago. I'm filling in for Dr. Edwin McDonald today, and we have three panelists, Dr. Leah Goldberg, Commissioner Bill Lowry, and Ms. Candace Henley. And so I wanted to bring it back to Commissioner Lowry because we were talking about some barriers that people might have to getting their screening. And I just wanted to know, both from your experience as well as hearing from some of your constituents, what some of those barriers are, especially if there are some resources that people might have available, but they just have not been able to take advantage of those resources.
Thank you, Doctor. So some of the barriers that I've heard from a number of individuals in our community, it's just past practice for a lot of families and individuals within those families. The custom is you go to the emergency room if you're not feeling well, and you do that instead of having your annual with a primary care physician. And others have said, well, I don't have a primary care physician. How do I get one? And whether you're going to University of Chicago Medicine or you're going to Cook County Health, you can always get a list of physicians and you will get help relative to it. So I think we've got to acknowledge that. The other thing I'm hearing, and I get, is individuals are more comfortable getting healthcare treatment from individuals that they can relate to, individuals who look like them. And mindful of that, I'm very proud to share that we've started the Providence Scholarship Fund within Cook County Health. And over the last 3 years, we have resourced students from historically disinvested communities who are studying for careers in healthcare. And it's a wide variety of careers that are represented by the groups that have been in the various cohorts. We start seniors in high school. We go through actually beyond college. Again, resourcing individuals studying for careers in healthcare. And this is an investment in our communities, an investment in our youth, and an investment in healthcare. So we have resourced just under $5 million to over 300 students over the last several years. This year's class, we started taking applications last Thursday, March 12th, and those applications will be received through April 19th. And you can get more information about this by going to cookcountyhealth.org. You can also go to cookcountyhealth.org to get information about my birthday health screening program, or you can call to set up your own screening appointment by calling 312-864-4289. So that's 312-864-4289. Also, Candace had brought up getting the messaging out. I'm pleased to report that I'm now collaborating with the city, and we're using their billboards, we're using their newsletter to advertise this opportunity for the health screening. And we're going to keep on just trying to get other partners to get this very vital information out, churches, et cetera, and in programs like this. So I'm so grateful that you've invited me to do this today. The other important thing I wanted to touch on, and I said it earlier, behavioral health care is just as important as traditional. And in 2025, we opened the Behavioral Health Stabilization Unit at Providence Hospital. This is a way that any of us going through any type of acute behavioral health issue can get immediate care by going to Providence. You could do that today if you present to Providence. We also have opened the Bronzeville Health Center. This is a building that Cook County Health took over, 31st Street right off of DuSable Lakeshore Drive. And for longer term behavioral health care, you can go there. And we also have family medicine that we're providing there. So again, one of my focuses is to increase accessibility, and we're going to keep trying to do that.
Yeah, that Bronzeville Health Center is beautiful. It's on my running route.
Yeah,
so I've seen it from its inception.
It is.
That's great. So, Ms. Henley, you had mentioned that you are the founder and the CEO or Chief
CSO.
Surviving Officer
Yes.
of the Blue Hat Foundation. And I know from personal experience being a part of some of these conversations that you all address a number of different things, particularly some of the barriers to getting screened for colorectal cancer and now also for prostate cancer.
Yes.
So can you just give us a little bit more information about what some of those conversations are like and some of the resources that you all have available?
Yeah, so the conversation started, with me wanting to do something with my grief and trying to understand the decision-making process of why Black men don't get screened. What is the reason that's preventing you? And having heard, from, I feel fine, I don't need to nothing goes up my butt, was like infuriating, because it was like, do you understand the other side of that? And so wanting to get to the why, we started having these conversations with Black men to understand that and provide the resources while we're having these conversations, because if they're not getting screened for colon and prostate cancer, what else aren't they being screened for? So we have a healthcare partner in there, in the space with us to do diabetes screening and blood pressure, while they're there. And to, not to our surprise, we've had some people come through and we've had to send them, to the hospital or to their, primary care for follow-up. But we also provide, we're boots on the ground. So we're not trying to repeat what everybody else is doing, because the community is different. We have to be visible. So we are engaging in activities that connect to us, resources that mean something to us. Our basketball tournament, Hoops for Health, is an intergenerational basketball tournament to help educate young boys and to grown men about what colon cancer and prostate is. We have our Blue Hat bow tie Sunday, which is educating the community that blue is the color of colon cancer. And we also bring a health component. Everything that we do is education through participation. People are more inclined to take care of their health when they understand better. And if we are speaking the language of the community by providing the education that's easy to understand, not too much, it's not medical jargon, but also put a face that looks like the community and experience, it's easier for the community to accept. And it's easier for them to ask questions because a lot of times we're in a space where we're like, I don't want to sound stupid or I don't want to sound like, but if I can say to you, listen, I know exactly where you're because I didn't know what it was before I was diagnosed either. And a lot of times we find that people are just trying to find a way to connect. And then every time I would tell my story, somebody would say, oh my God, my granddad died from colon cancer. My aunt, my mom, and I was motivated to say, we have to stop hearing somebody died of colon cancer. And at 35, for me, I was like, where is anybody that looks like me? And there wasn't in 2003. So I was motivated to do the boots on the ground. So while everybody else was being national, I was like, we need to be in the community. And so that's exactly where we are. And so we partner with hospitals like, University of Chicago and Northwestern and UI Health and other community partners to raise awareness and provide education, in any way possible. And then, our presence is national because our Blue Hat Bow Tie Sunday is now international because we partnered with the Global Colon Cancer Association to raise awareness of colon cancer in countries that didn't have awareness. We also partner with Cologuard. So next week, we're headed to the Cologuard Golf Tournament. Presence matters because we don't see spaces. We don't see places like us in spaces like Cologuard. And so we're going there to show their presence so that we can continue to raise awareness and educate people and say, get screened on time because our community has the highest rates of diagnosis and death. But it is preventable. And all you have to do is get this test and don't let fear carry you.
I love that. So as we are kind of wrapping up, one question that I had for each of you all is what's one action that you would like for our listeners, to take this week in thinking about and potentially trying to screen or prevent for colorectal cancer? So just putting something tangible and actionable in our listeners' minds that they can potentially do. So Dr. Goldberg, I'm going to start with you.
Absolutely. So I think if you are up to date on your colon cancer screening, congratulations, great job. Please recruit someone that you know, someone you love, whether it's a friend, a family member, a colleague, recruit them to make an appointment with their primary care doctor to talk about screening. Because I think some of the important myths that we've tried to highlight today is that, if you have no symptoms, you can still have colon cancer. You still need screening because that's the only way to prevent bad polyps from developing into cancer. And second of all, if you're young, your symptoms still matter. So don't let a young age make you think that, oh, well, I'm too young for this, because colon cancer is the most common cancer now in people under 50. And so it's really important that any symptom is taken seriously. So if you're not up to date, please schedule a doctor's appointment. If you are up to date, find a friend who can schedule their appointment to talk about colon cancer screening and awareness.
Thank you. Commissioner Lowry?
I would say schedule a physical during your birthday month. Gift yourself by doing so.
Thank you. Ms. Henley?
And I will say family secrets kill families. So it is important to know your family health history so that you can share with other family members and know if you are at a family risk of developing colon cancer and any other disease.
Okay. All right. So are there any last words that you all might have or any plugs that you all might have?
Yes, they can follow us on social media, Blue Hats for Colon on Instagram, bluehatfoundation.org. And if anybody would like to have any more information, they can email us at info@bluehatbowtie.org.
Thank you.
So I would like to make sure everyone knows that the annual Cook County Health Colon Cancer Screening Educational Fairs are kicking off this month. There'll be a fair from 9 a.m. to 12 p.m. at Providence Hospital on Monday, March 23rd. There'll be a fair at Bronzeville Health Center on Wednesday, March 25th from 9 a.m. to noon. There'll be a fair at Stroger Hospital Thursday, March 26th, 9 to noon. Same day at CCH Professional Building, which is on 51st Street from 9 to noon. And then there'll be a fair at Austin Health Center Friday, March 27th from 9 a.m. to noon. And again, all of this information can be gathered if you visit cookcountyhealth.org. Same site for you to get information about my birthday health screening program. And then lastly, again, the number, if you want to set up your screening, be it at this point for mammograms or for prostate screenings, call 312-864-4289.
Okay. All right. So just want to thank you all for your time and your wisdom and your energy about colon cancer. So it's definitely important, especially in March, which is Colon Cancer Awareness Month.
Yes.
So I appreciate the platform that we have today, and just wanted to remind you all that today's conversation is not just a screening test, it's a lifesaver. So please, if you can, don't wait, talk to your doctor, talk to your family, take some action. So I wanted to thank Dr. Leah Goldberg, Commissioner Bill Lowry, and Ms. Candace Henley for sharing your expertise, your passion, and your support. So I am Dr. Ross McMillan, a gastroenterologist at the University of Chicago. I'm in for Dr. Edwin McDonald today, and this has been Uchicago's Community Health Focus Hour on WVON. Special thanks to executive producer Twyler Jenkins, production manager Titus Williams, and board engineer Sapphira Willis. Join us next Saturday at 1 p.m. for more conversations that empower our community. Keep us healthy and keep us at the forefront. Take care of yourselves and each other. Thank you.
Thank you.
Thank you.
Thank you.
The talk of Chicago is 1690 WVON, Berwyn, Chicago.
Here we go again. More nonsense. Corporate big shots come here, promise to help the community, and when it's over, we get boarded up buildings, they get pockets of cash. Same old, same old.